Genetic counseling really helped facilitate us getting tested in the first place. And by doing so, I was able to take proactive steps. And in essence, could have saved my life, and probably did save my life.
I'm Fred Cass. I'm a medical oncologist. I've been at the Cancer Center for almost 30 years. With 3 full-time genetic counselors, we're really one of the premier genetic counseling programs in the state of California.
My name is Danielle Shiraga, and I'm a genetic counselor at the Ridley Cancer Center here in Santa Barbara.
I'm Hannah Andrews. I'm a licensed certified cancer genetic counselor, and I work at the Ridley Cancer Center.
My name is Ayanna Boyce. I'm a genetic counselor at the Ridley Cancer Center.
When one becomes a genetic counselor, we go through a master's program for genetic counseling, where we are trained both in medical genetics and then also in counseling.
For us here at the Cancer Center, we work directly with people who have either a personal or family history of cancer. Typically what a genetic counseling session might look like would be starting with taking a patient's personal medical history and then moving to look at the family history as well.
It's very important that we ask questions about both mom and dad's side of the family, as both sides are important.
Taking those two in combination often helps us assess what might be happening in the family and if hereditary cancer is a possibility.
And if we find those features or clues, then we will talk about genetic testing as an option. And genetic testing can help personalize their screening recommendations or management recommendations for that individual and their family.
So there are certain features that we look for when we take a patient's family history. So there's a few clues that can help give us an idea if hereditary cancer might be a possibility. So we look to see if there are 2 or more people that are closely related with the same types of cancers or cancers that come together. For example, 2 people with colon cancer or colon and endometrial cancer together. We also look to see if there's young ages of diagnosis, so for certain cancers being diagnosed under the age of 50 can act as a clue for hereditary cancer just because they're less common under the age of 50. We can also see a pattern of multiple generations affected, so a grandparent, a parent, a child, all with cancer. That can act as a clue for hereditary cancer. We can also look to see if there are any rare cancers. So something like prostate cancer in men, breast cancer in women, unfortunately are just very common. But when we see an ovarian cancer in a woman, that is more rare, and that makes us think about the possibility of hereditary cancer. And a last clue that we look to is ancestry. So there are certain ancestries that we think about for certain hereditary cancer conditions, with an example being the Ashkenazi Jewish population or Eastern European Jewish population. When we know that someone is Ashkenazi Jewish and has breast cancer, that makes us a little bit more suspicious for hereditary breast and ovarian cancer. Genetic testing results take a little time to come back, usually 2 to 4 weeks at this point in time, and then we always like to meet with our patients in person to go through the results, explain what they mean for both them and their family members.
When a genetic counselor talks to someone about genetic testing, they're referring to looking at the DNA through a blood or saliva sample. And that can tell us if there's a gene change or mutation that might increase someone's risk to develop cancer. When a genetic counselor talks to someone about screening, they're usually referring to things such as mammograms, breast MRIs, colonoscopies, different tools, screening tools that your healthcare professional will use to help you screen for cancer. Sometimes genetic testing isn't indicated or an individual isn't interested in genetic testing, and so at that point we will talk about what would be recommended based on the family history itself or the personal history for that patient, and specialized management or screening based on that.
So as a genetic counselor, we're definitely working as part of a team with the rest of your healthcare providers. So first of all, whoever refers you, whether that is your primary care doctor, whether that's an oncologist, whether that's your gynecologist, we're going to be communicating with them about what is talked about in the session, what ultimately the decision is, what we're seeing in the family history. It's something where we definitely are going to be communicating any recommendations based on our meeting to the other members of the healthcare team.
We definitely encourage all patients who've been referred by their doctor to come in and see us, to have a conversation, to learn more about what might be able to help better their health and the health of their family.
Genetic counseling is very important for a specific group of patients I see. We know that most cancers are not inherited. However, about 5 to 10% of cancers are inherited.
So often it's really helpful for people to come in to get this information, even though it might be scary to hear that you might be at a higher chance for developing cancer. Learning about it ahead of time can be really powerful to have that knowledge so that they can set up the best system for them going forward.
The hope with genetic counseling is that through genetic testing, the patient may uncover something that they had all along and just didn't know about it.
We think that this is not only an issue of treating patients who have been diagnosed with cancer, but reaching out to our friends and neighbors to help them prevent the occurrence of cancer in their families. That's a hugely important part of our program.
Maybe you're not the right person to consider genetic testing. Maybe there's someone else in the family who's going to be more informative, and their genetic testing results might be more helpful to the whole family.
With that information, we're hoping that we will now be able to change screening and management to result in early detection of a cancer or possibly prevention altogether.
Genetic counseling represents one of the most important areas of ongoing development in the science of cancer medicine. But in addition to that, this is a real service to the community. We're looking to find families who may not realize that they have inherited a risk for the disease.
Cancer was taboo, and it's not a disease that needs to be hidden. We need to know about it, we need to be aware, we need to test for it.